Michelle Berry, people think you're actually in tech. What would you say you're actually in?
We are actually creating bridges to empower people to take care of themselves on their own terms and for as long as possible.
All that and more on Transformers. What is transformation and who are the people leading the way? My name is Anne Fanai, CIO and Vice President of Business Platform Transformation at IBM. Join me as I talk to my fellow nerds about some of the most exciting things happening in all different kinds of business. Today, really very human-centric episode I'm super excited about. This is Transformers, a Think podcast. So, Michelle Berry, thank you so much for joining me on Transformers today.
I'm so happy to be here. I'm really excited for the conversation. Thank you.
You are both CEO and co-founder at your company, CTI Life Health. Why don't we just start by telling us what CTI stands for and what you do?
CTI stands for Community Transformation Through Innovation. So we're all about transformation. And Life Health is honestly trying to bridge the gap between lifestyle and health with a capital H, the medical side versus what we actually do when we're not at the doctor's office and the clinics. So that's the name of the brand. And we are a digital health ecosystem. So we've got a tech stack that's a modular end-to-end solution for bringing primary care to difficult to reach and underserved markets, ranging from our own backyard, difficult to reach markets, all the way through to places like Africa.
Fascinating for me is, a lot of your colleagues are actually based in Africa. This is truly a global company from day one. And like, have you seen any variance in I guess innovation? What is needed for transformation for innovation in this space? Whether if it's U.S. based, your colleagues in Kenya, et cetera. It's like I'm really excited for this conversation with the really full, total global view you bring here.
It is a global view for sure. So our team, my entire team, is in Africa, and the company was actually born out of working to empower people in Africa. So it was built in Africa for Africans and by Africans, and so the whole model of taking a truly underserved market, starting in Uganda, and looking at spaces that have absolutely nothing when it comes to digital healthcare, or even medical or med tech innovations, and trying to bring that into market is where we started. And so I think in doing so, when you don't have an infrastructure in place like we have in the United States, where we've got hospitals and clinics, and we've got telehealth these days, and COVID forced us into expediting some of our behaviors and moving things around a little bit more quickly. When you're in those types of environments, you really start from the ground up. And we started with the patient first. We never started from the institution side. We actually ended up over time building to start paying respect and attention and delivering innovations for the providers and the facilities and the payers, et cetera. But it always started with the people. And so the way that we designed it broke a lot of the rules that we could not have done if we would have started our innovation here in the United States.
And speaking of people first, I think you've got a very fascinating academic background too, and I wanna make sure I get this right. Medical and sociocultural anthropology PhD, so
Yeah.
an amazing breadth of work, and how does that play into what you're doing here? And I'm assuming, it ethnographic research, that sort of stuff, but how does your academic background, like, bring you to this place as well?
Well, first, I have to be able to pronounce my degree. Like you said, sociocultural and medical anthropology is a mouthful. Most people don't know what that is. Basically, what it's done for me, and I did do my doctorate in it. It was on health, and it was on looking at things from a systems perspective and trying to understand how you influence mass and cultural and behavioral change at the local level, and by co-designing it in a very inclusive fashion with the people who are intended to use it, but also bridging ancient wisdom with new technologies, and we're figuring out what the trick is. How you can't just take new technologies and drop them into new ecosystems that are not culturally responsive. So having that degree forced me to learn how to listen and I call it listening loudly. And I mean, there's a lot of nuance in what we do and paying attention to the cultural rules, the norms, your permissions. How do you establish trust? But also, I think a lot of people think of something being culturally responsive being just changing the language. You know, okay, we translated into Swahili and now we're good to go. We're culturally responsive. And it's like, no, actually, you're not. If you don't understand what's going on in the ground and partnering with those who are actually the gatekeepers of that sacred space of community and what the cultural norms are, and those are everything from people in the community, elders, people in even like religious roles, like NGOs. There's a lot of different factions that help decide whether or not a new technology will even have the chance to show itself, much less be adopted and then scalable over time. So for us, we take the art, like you said, ethnography is one piece of it, of being on the ground and really understand the environments that we're dropping into. But the other part is having respect for the cultural differences. And sometimes our communications, especially being in the health tech environment, look nothing like anybody else's. We use cartoons, we use iconography, we use symbolism, we use comic books, we use music, we use art, we use a lot of different tools that have absolutely nothing to do with coding, has absolutely
Oh,
nothing to
yeah.
do with being a SaaS company. It is quite literally, how do we get the message out? Because you've got different types of literacy. There's cultural literacy, digital literacy, health literacy, and being able to scale that and pull it across environments that are usually underserved as our niche. And so you're talking about rural, lower income, difficult environments like refugee camps, for example. There's a lot of hard areas that we're in. So you've got to work harder to understand how to integrate.
I would imagine, when we start thinking about, us sitting in the US, right? There's AI is everywhere. How's AI going to evolve? That's not something that's a band-aid or that you can deploy easily. Like it may not even be, I'm making a guess here. You'll have to keep me honest here, but it's like it may not even be something possible or accepted then if you're really doing the listen loudly and understanding what is accepted in those places. I have to
Mm.
imagine is there some resistance? Maybe I should pose it as a question.
Yes, there is resistance, not just in places like Africa that we serve, but also in the United States. The culture and the communities that we serve are on the edges of what a lot of people think about when they think about AI. I think that people who are thinking about AI and tech are thinking a lot about privacy and things like that. And we're talking about serving vulnerable communities that are also, oftentimes, data is used against them and not for them or on their behalf. So, the data sovereignty and the access and the control of the data, and then how that data is used for AI, it's only going to be useful and trusted AI if the inputs to the AI are the right inputs. And so, it's not about coding, it's actually about sovereignty, it's about health equity, and it's about understanding what is permissible, what's useful, and what's the right timing. In some of these other environments, there's nothing digital, not one thing. Everything is still going back to paper, if even the paper trail exists. And so, bringing in a full plug and play digital health ecosystem that's intended to quite literally bridge the gap from the patient to the provider to the facility to the government at times. Dropping that in is like dropping it out of a UFO in some environments. It's literally like, what the heck is that? So the distrust is very high. I think there's concerns about, is this going to replace me? And what we spend a lot of time talking about on the ground and with our partners on the ground, and we have many of them, is you have to ramp the human agency and the human element even more so when you're bringing AI in. It is not a displacement measure and it's not an outsourcing or dangerous mechanism. It's meant to personalize and give them control and give them power. So we work really hard in finding these solutions where the inputs that they're allowing us to use about their health records, their biometrics, their consumer shopping behaviors, all of the information now that's coming in that's now available to us, we give it to them to control. So they control and they can also share or revoke their own personal medical records. So we're trying to put that agency right back in the hands of the individual and not sort of make it subject to being used against them, but it's actually being used on their behalf.
So in those situations where it was the UFO analogy that you gave, have you seen some real good tangible examples of where that's bringing that digital ownership, that data, the data ownership, the data sovereignty to the person, back to the yoga, you guys are about that individual person. Have you seen like a really positive, tangible change when you've been able to get past this is a wacky UFO and say, this is how it can help you?
Yeah, I think once they start to understand, and and every environment's different. This is I'm making, we're kind of going to the extremes of things. I mean, there's a lot of in between, and I think that's also what a lot of people don't understand is that certain countries and even certain areas or regions within certain countries, they do have telehealth, they do have digital, they're very well versed with phones, and they have infrastructure. And then there you go to the other extreme where there's almost no infrastructure and no phones. So I'm kind of pulling it to the extreme side. But in some of the more extreme sites, for example, we were working with rural farmers and their families, and we brought them the digital health platform so that they could start to access services that they normally hadn't had access to. And what we found in that sharing and that access is that once they understood, that they had like a QR code that they could share or scan or print, as well as having an app if they had access to a tablet or someone on the farm did, that it actually empowered them and their families not just to avoid unnecessary hospital visits that are very expensive and difficult to access and require boat arrives, drives across vast distances. And we've been able to help make a more efficient triage of care, but it's also better follow up care and adherence for things like medications. So we do see different tangible touch points of where it's making a difference in terms of cost, in terms of convenience and accessibility, but also in terms of behavioral change for adherence and understanding the why behind what they do. And we take that part very seriously about if you are diagnosed, for example, with diabetes, what is that? Like, why do I care? When should I worry about it? What do I have to do? So it's a vehicle also for education just as much as it is to access for healthcare and more affordable diagnostics, for example.
You just spurred a slightly different thought when you were we're talking about the edge cases, right? Like,
Mhm.
we kind of know the most modern, what folks would accept to that corner case. Is there, as you've designed your solution, do you obviously, or I shouldn't say, again, I shouldn't assume here because this is an area that I am not an expert in this field, but it's to some extent you do have to design for the middle case, though. You don't want to design for the corner cases, but is there a real danger in not taking the corner cases into account as you're thinking about the systems design that you're doing?
Well, if you wanna scale a company, yeah. I mean,
Okay, fair.
if
Fair
you
enough,
just wanna
fair enough.
hang down the middle and play it
Yeah,
safe, that's
yeah,
great, but that's not
yeah,
what we're about. I think
yeah.
we take on the challenging situations, whether that is, difficult, underserved environments like, rural Africa or in our own backyard. So, we're looking at, elderly living at home, could be in rural Alabama, and it's the similar problems and similar solutions, and that's the middle. The middle isn't about income or socioeconomics, or it's really more about the actual need that we're serving, and the need is huge. That middle is there's more corners than there might be middle. I mean, honestly, if you start thinking about veterans, if you start thinking about elderly trying to age in place, you start talking about rural or low income, addicted and people in recovery, like all the areas that we specialize in because we're used to difficult environments and hard to place systems. There's more of that going on in general than there is a kind of a nice, safe middle where we're just trying to get people to move from a telehealth to, maybe I need a remote patient monitoring device so that I can check my blood pressure more accurately and have it automatically entered into my digital health wallet, right? Those are it's a different level of care. We haven't addressed the basics. I
Mhm.
mean, the most basic
Yeah.
systems. We think we're in charge and in control here in the US. We are not.
No,
We
we are
are
not.
not in control. We're not in charge, and that's what we're trying to do is bring that control back in under our own roofs, right? So, how do you reclaim information and even like a wisdom that we used to have If you even go back to the late 1800s in this country, we were far more sophisticated about what to do if someone in the house got sick or we were out on a farm and had to take care of ourselves. We had tools, we had tricks, we had our own kits. The doctor would come to us. We're just trying to bring the doctor to us now, but the systems that we have in place don't work. So the middle might be smaller.
It's so interesting about how you laid that out. We talk, if you're thinking about pure technology plays, right? Like, I'm going to build a tech company that services a technical niche or a technical need. You are looking to serve that middle first and then pick where you differentiate. In your case, I think you might have used these exact words, right? The corner cases are the case that you're serving, right? And so
Exactly.
the business. You can't be constrained by maybe a technical model thinking. Like, if you brought in a CTO or a CIO from a tech company, they probably would have had the instant reaction I did just here, when that's not at all going to be the goal.
We are working at a solutions level, and I think that's the confusing part, and that's the opportunity. I think that, a lot of companies, they have a widget, they've identified the biggest, possible market, they know how much they're gonna sell it for, and they know where it goes, and, it's a very transactional type of situation. Because we've created an ecosystem that is heavily reliant on a multitude of partners ranging from IBM, thank goodness we have the IBM partnership, all the way through to on the ground implementation teams that live there, that are boots on the ground, the community health workers, the traditional healers. We are working across the full ecosystem. And what that does is it actually creates a much bigger opportunity for us as a company because there are billions of people in the world that need this. I mean, billions of people in the world that need this. So if we just decided to play it safe and take our ecosystem and drop it down to one module of our platform and just declare we're a telehealth company on steroids, that would be doing a massive disservice to what we're actually trying to do. We're really here to take care of the things that nobody else wants to take care of or can take care of, frankly.
Something you and I, touched on prior to the podcast is one of the previous guests was Sarah Hatchett, CIO over the Cleveland Clinic, and
Mhm.
again, it's almost like you're flip sides of the same coin a little bit, right? They're the very institutional health, and you guys are smoothing maybe the gaps in, are you taking your medication? Are you taking care of yourself? And be curious your perspective on that institutional view versus the complement supplement that you guys are bringing to the table.
Yeah, I think that's such a great example. And I think the work that Sarah and her team are doing is phenomenal. They are best in class when it comes to innovation. And I've been a longtime fan. So hats off to them as an institution. And I think that what I would say is, as a company like ours, we share the same ethos. It's still a patient-centered ethos. And I believe that they do, really track to that same standard or mission. But what they have the benefit of is they have the benefit of walls and a contained space that they are really working to innovate within and control. And what we're doing is we're working to be the bridge to that care that's not happening inside of the facility, and also not just provide access to services and bring basically trying to bring the institution to the home or some version of it, but also what happens in the home needs to flow back to the institution. And right now, that's not happening very well. I don't know about you, but like the I've got an aunt right now who's an hour away, and she's in stage 4 cancer, and I'm one of her primary caregivers. And I can't tell you what she took today. We do not have the technology right now. So I'm one of her primary caregivers alongside with our cousin who's a power of attorney. I work in the space. I work in medical. I work in health tech and all these things. But the reality is that without this system, she's had care with cancer spread out across different places. I've had to take her not to her hospital she normally goes to, which is on one system. I had to take her someplace else. We literally had to start from scratch when she was in a very urgent, I mean, life-threatening situation. They couldn't it took forever to admit her. We could not get any of her medical records. It was the middle of the night. I didn't know what medication she was on because the caregiving team in her home hadn't been able to accurately document, and she'd been going through a lot of changes between home care and and going on and off hospice. We also, because we couldn't do that, we couldn't get a prescription on her release, and they had to call multiple different people to find it. Once I got her home, we were supposed to be checking her blood pressure, which was jumping up and down. She has lung cancer, so we were supposed to be checking her pulse ox constantly. She had really old tools from a retail pharmacy from probably back in the 80s that were in like a bottom drawer of her medicine cabinet. None of them were accurate. We were getting wildly different readings. We tried to go onto Amazon just to buy some stuff and online and get it delivered to the house, and they were out of certain things that she needed, or they came and they were the wrong size, the wrong fit. We couldn't get transportation for her to get back to and from places. Um, and then most importantly is that I have no information to make any decisions about her care, even when I'm sitting right at her bedside, but far less when I'm an hour away from where she actually lives. And my cousin, who's not in this space and who's the power of attorney, she can't do anything about it. Right. So the point being is that even though there's doctors everywhere, there's pharmacies everywhere, there's retailers online, offline, Uber, like there's all these all these things that are at her fingertips. It has not been brought under one umbrella where everything's talking to each other so she can click the button, or her caregiver, whether that's me, she can share her records with me so I know every day that Grace took this medication. I know what her blood pressure was, I know what her pulse ox was. I know where how to get her medical records because she's going to radiation on Tuesday at a different place than she had before. And I can give all that back to Sarah. So there's a whole line that when she goes to hospice, we don't sit there with hospice doing handwritten 2-hour interviews when she feels horrible. I'm stressed. Everyone's, at their wits' end. I can just share them that QR code or that link, and all the information's right there. And guess what? It's accurate, it's real time, and it's hers to give. It's her data, and she's saying, I want you to have it. And you know what? I don't want you to have it anymore. You're not my doctor anymore. And she has that control to revoke it if she wants to. So at the end of the day, I believe firmly, and this is not my first time to that rodeo. I had it with my dad with his pancreatic cancer. I had cancer. Like I've had these issues of no medical records management, no active real 24-hour telehealth, nobody who could come with transportation who knew what to do with someone in a walker. All of these things are things that we've been solving with our partners and with our ecosystem. So I can now, if I had this actively here in our state, I would be able to not even just take care of her every single day and have check-ins and alerts, but I'm going to be able to communicate much better with her care team, her doctors, and the family so that I can tell them, guess what? Grace's blood pressure looks a mess. Someone needs to call 911, or better yet, call that transportation that specializes in wheelchair access and can get her there safely. So there's a lot, and that's just a real time thing. And I know if that's happening for me, that is happening for millions of people every single day in this country.
Yeah, I mean, it's that last mile of the
Truly the
patient-centric
last mile.
is I mean, my comparable is my best friend, my ride or die, had ovarian cancer, passed last year, and I was her primary
Ugh.
caregiver before we got her into MD Anderson, and we had a situation that
Mm.
was emergent, and she was at 10 different centers where we were located originally in Austin. It had emergent closest hospital, they're like, "Well, you're gonna have to have 2 hours of intake and do that. So we'll go to this hospital that should have her records." And even then, the records weren't fully transferred from her oncology center at that
No.
point. And I mean,
Exactly.
it was truly like that moment was a life threatening, which, thankfully she overcame that and had a few more good years. But it's, that last
It
mile
is
of being able to make
life-threatening.
that connection. And then when she got to MD Anderson, yes, had some of those abilities. But again, I'm now in Austin, she's 3 hours away in Houston, and it's okay, who am I checking in with? Who's on
Mhm.
rotate who of the girlfriends is on the rotation, right, this week as things got worse, so, yeah, no, that
Exactly.
again,
I'm so
that
sorry for the loss of your
and
friend. And it was the same thing with my dad. He had
mhm,
pancreatic cancer, and we had 13 months, and this was a couple years ago, right during COVID. He was diagnosed right when COVID, started,
this
and
was exactly what happened with her, like, literally,
yeah,
I think
so
it
it was
was,
even worse, right?
yeah,
So you've got these
yeah,
situations where you are truly held hostage by
mhm,
everything, by the whole system. And I think, we spent so many hours working on spreadsheets and trying to email the doctors and trying to connect the care. He had 13 different facilities he was at, and 27, I think, doctors we figured out are providers. And it doesn't include things like acupuncturist
Mhm.
or the nutritionist or the herbalist, or
Yep.
because we were doing every therapy we could find and
Yeah.
bring in because, biohacking, I can't help it.
Yeah,
So
exactly. No, no,
we were
exactly.
like throwing everything at it, right?
Yeah.
And if I could have been scanning these even on my own phone, but I had a place to store it and share it, we missed out on a clinical trial because of that. We could not get the information gathered quickly enough and to get everything submitted. So it's like this is literally a game changer in being able to not only manage the continuity of care better, but to empower the individual and their circle of care to be truly responsive with real information and make the right decisions based on what they have at their fingertips, as opposed to guessing and hoping you made the right choice, because that is a horrible feeling when you make a decision and it's not based on data or real-time information that you can share or access. So, and that's what most of us are making our decisions on.
Again, one of the things I found I appreciate it because it's something I thought I was doing well, but I think you blow me out of the water on this is the idea of body hacking as well, right? You are
Oh.
just like and you well, I mean, there is this
Yeah.
nice contextualization. There's again, what happens in the institution. There's the reciprocity of the data, right? Like make sure what's happening from a medical instance, but like, are you getting
Mm.
enough sleep? Are you, as much as we all, if everyone with an Apple Watch laughs at, oh, I got to stand up, right? But like those moments that are just little small pieces of body hacking, though, become so important. And during the pandemic, I was working with Under Armour, and one of the things I'll always be grateful for is, said, look, we are a fitness company first, and they encouraged us to go out, walk. Let's, use the Under Armour Samsung watch, put your connected fitness shoes on, use our apps. And like, it's kind of what got me started on the body hacking journey a little bit with many of my, friends to this day.
Mhm.
And you take the whole body hacking to like a level that I could only dream of achieving, but I do think there's a tie to like it's the totality of our health. So much we think about
Yeah.
like we're talking about AI and tech and what it gives it to us in our work, but I really truly have this hope that everything around your personal well-being, like it's the whole person, not your whole person at work, but the whole person, and what we're gonna learn from, you know, the the well-being, opportunities outside of an office or outside of a work environment. That is gonna be so important going forward, in the world, but again, this is my personal view, but, like, I know, again, you've got done some really fascinating work personally on the body hacking as well.
I think you're so right. And I think that goes back to what I was saying about ancient wisdom and bridging that with technology, because tech isn't going to answer everything. It can't replace sunlight. It can't replace electrons in the ground. It can't replace, um, you know, uh, uh, bioavailable water, where our cells actually recognize it. It can't replace the sounds in nature that help us balance our nervous systems. So all of these things aren't necessarily things right now with CTI Life Health that we are trying to socialize yet, because there's a process to that. And this is in quantum biology, and some of the things that I've been doing for a long time are just coming to market. And I think right now there's still a sense that it's kind of woo woo or it's far out there, except now all of a sudden people are saying, oh, my circadian rhythm. And,
Yeah.
maybe I do need to, let sunlight in my retinas at first thing in the morning because it's doing something for my mitochondria. Like the more you get into it, the more fascinating it becomes. But I think that is the balance, is getting the education and information out there. And information is digested in different ways by different communities, and you have different permissions to say it in different settings. But I think right now our basic thing is, can we be a vehicle for possibilities? And right now our biggest bridge that we're trying to gap is basic access, basic affordability, basic connectivity, and basic shareability, because we are oftentimes living by ourselves in our bodies and we are not connected to our communities, whether that's our parents or a caregiving network, our community, our neighbors. We've sort of isolated ourselves to become our own little sphere, but the reality is we need to have that connectivity. So we are about bringing the people together just as much as we are about bringing the solutions. And what I love about Africa and emerging countries is that there's there's nothing there. So your ability to leapfrog old institutional ways of thinking, doing old stuff that you have to try and figure out how to fix or how to add on to, or it just isn't there. So the ability to bring in best in class technology, best in class wearables, best in class genomics testing, these are all things that are on our radar. So we're geeks about early adoption, me in particular, but so is my partner, Michael. Like, we are always looking for what is that new thing that is going to not only have a biological impact, but a social impact and hopefully be sustainable. But the ability for these new platforms like ours to take and launch, just launch all of these new products, it's going to make these emerging countries far more sophisticated and far more advanced because most of those environments and communities have not lost the indigenous wisdom as well. So they're still practicing plant-based medicine. They're still practicing movement. They're still practicing song. They're still practicing a lot of the things that in the industrialized worlds we're sitting here like
Yeah.
we're on
Oh, yeah.
Zoom, we're in offices. Our Under Armour had to tell you, like, please go move. And it's like, well,
Yeah.
that's because we live here. And like that would be a really
Mhm.
weird thing to say to somebody.
Yeah.
Like,
Yeah,
in a lot of
exactly.
environments, like, get outside and move. They'd be like, what are you
Yeah, they
talking
would
about?
like, "That's all I do.
Right.
I wanna go sit in an air-conditioned office.
Exactly.
Please tell me
So
that."
it's
Yeah.
so fun. So,
Yeah.
how do you harness that information? But we're actually leapfrogging. And at the same time, we have this really unique moment in time to weave together very relevant, meaningful, and effective solutions. But it's going to take time. It's going to take a lot, and it takes far longer than you think. I mean, we're working with governments and nonprofits and trying to get culturally oriented to new systems. The infrastructure challenges are like constant. So, trying to partner with the big telcos and all of these things literally take years to do, and so it's snail's pace, and our hope is that with people like yourself and getting this conversation started, that people see the opportunity and they're willing to support it, because right now a lot of that support's been pulled from, innovation and things happening globally, and so even in our own backyard, right? So we're trying to figure out how do you get get it from a grassroots level almost. How do we go from the ground up together and make it happen?
I often think about how you think about companies with a longer heritage, how sometimes moving to the newest stuff is hard because they've got ingrained ways of doing things, ingrained
Oh, yeah.
process.
Mhm.
Well, I have this data flow over here that I'm going to have to rip out or a new system I have to put in. There's almost a beauty to that being able to leapfrog. And I mean, it was similar to the cell phone era. There were a lot of countries that never had landline phones, right? And they would just skip that, went right to this, didn't have to rip out a landline versus I'm pretty sure this building was built in the '80s and there's landlines in these
Yeah.
offices here somewhere. And
Yes.
to get them to adopt, in that, green field, they don't know what they don't know what they miss, but that's probably a good thing in some cases.
I think for the most part, it's a blessing in disguise. I think it's been a lot of suffering and a lot of need out there for a very long period of time, but technology and AI, and globalization has enabled this to happen now, and it's gonna happen overnight. It will happen so swiftly that we're all going to blink and say, "Wow, how did" what took, 50 years to happen in the US, it's gonna happen better and faster, our lifetime for sure, but maybe even within the next 5 years. I mean, there's some global mandates for 2030. That's only 5 years away from now, so the race is on, and it takes a village for real. I mean, I cannot emphasize enough the partnerships and how incredibly important they are. No one company can do it. You just can't. So if you're not willing to play well in the sandbox, if you're not willing to work on partnerships and be flexible and creative, you're not going to make it. It doesn't matter how good your tech is, because at a point, it's not even about the tech; it's about the relationships that you're carving out. And if you can't sustain them, you don't have permission, and you have to move. You have to leave.
Yep, absolutely. No, and it's, the whole competition has is competition in today's world is very different than competition. It's so much more cooperation than it is competition anymore. And
Yes.
it's amazing. And one thing I want to go back to that you've said a few times is like this connection to indigenous ways, connections to the earth. I think you've also got another fascinating hobby side hustle, if you will, on art and music.
You're gonna make me have a coming out moment.
Yes. I mean, I think, but I think it's, again, what was fascinating as, we kind of got to know each other a little bit here was what you're doing, like everything about your being. It's not just your company, but it's really the sum total of who you are. And you've had a lot of
Mhm.
experiences that have brought you to this point. And even the music and art piece, it's really this, again, this connection to health, wellness, being the
Yeah.
betterment of a whole being. And chatting with you, it's like it's not just your job, like, this is really a calling almost, it feels like you
No,
have.
yeah, this
Eh
is this is why I
yeah,
was put on the planet. I'm not here to play small. I'm not here to play for me. I was born a little earth mama, and I was always there trying to like save the spider before someone crushed it in the office, or help the poor bird, or the person who never got picked for kickball, or like I was always the one that was there to try and help people take care of themselves on their own terms. That's what's most important to me. Doing certain things that are scalable, I have found, because I was doing one-on-one for so long as a practitioner and artist, and you can only touch so many people that way. And so now I feel that with CTI Life Health, we have the ability to reach masses. I mean, billions of people if we do this well and right, and in the pace that it needs to be done. But also with my art, this is something that I can literally give to anyone. And I'm working now with a team in Uganda with refugee children who've gone through severe trauma. And it's a new way of thinking, and it's a new way of doing. And that is what I've always been on behalf of, is impacting the stuff that is hard, and the things that actually a lot of people don't want to do. That's the stuff that motivates me. I'm like, bring it. I'll put everything I got against it and try and do it as well as I possibly can.
your passion is contagious, your love for what you're doing and making, the world a better place is just, it's so contagious. And thank you for doing what you do. I mean, it's, you've, in all, like, full transparency, like, I think what I've loved about this episode and digging a little bit more in is, like, this is just, it's stuff that isn't my daily. And it's, again, it goes with this balance. Is like, I hope as we become, as a tech person in a tech company, there's so much outside of this work that, I can do to make myself, better for my team, for the company. But it's like, just, I think you've given me like that little extra nudge is like, it is that moment of care for yourself. It is that moment of care for those around you. It is that, the focus, on someone in need. So thank you again so much for this amazing conversation today. So happy to have you on.
Thank you so much, and I have absolutely loved the conversation, and it's not just, cool to be able to express what we're doing and share it with those who are listening, but also I think the types of questions that you ask are extremely thought-provoking, and it is literally, these are the types of life and death conversations that matter, and I hope that everybody gets something out of this. But thank you for the way you interview and the types of questions you ask. They're very thoughtful and very relevant.
And to everybody listening or watching Transformers, we thank you for joining us, and we hope you will join us on the next episode soon.